Hi, I'm Dr. Mimi with Integrated Health Solutions, and in this video I want to talk to you about shoulder pain, what our approach is, how it's different, and how we can help. First, we need to find out what the source of your shoulder pain is. Many times patients will come in with a positive MRI. They already know they have a rotator cuff tear or labrum, and they want to avoid surgery, which is great, and we'll talk about that and how we can accomplish it. But many times we find the shoulder pain isn't actually coming from the shoulder. It's coming from the neck or an issue in the neck that's contributing to shoulder pain. So we need to figure out, where is your shoulder pain coming from? Is it truly a shoulder problem? Is it coming from the neck? Or maybe it's a little bit of both. It's not uncommon for people to have multiple issues going on contributing to their pain. So let's break it down a little bit. There are 3 joints in the shoulder girdle. You have your AC joint, the clavicle attaches to your scapula right here, your glenohumeral joint where your humerus attaches to the scapula, and that ball and socket joint, and the scapulothoracic joint, where the scapula moves along the rib cage in the mid-back. Now, I specialize in extremities and I love working with the shoulder, and one of the things that makes us different and why we get such great results is we check each of those joints to address any involvement. If any of those joints are restricted in the shoulder girdle, subluxated as we call them, if any of these joints aren't moving properly, that can create tension. Many times in the front of the shoulder, for example, the scapula, it often misaligns. It comes kind of up and out. And that can create a lot of tension between the scapula and the spine, but it can affect the front of the shoulder and create dysfunction, even impingement in the front of the shoulder too. So just an example of, just because your pain is in one area, in this case the front of the shoulder, doesn't mean the problem is coming from right here. Shoulder alignment can actually contribute to an impingement disorder, and if that's the case, most people will notice good change within just a few treatments. Even with a patient with a partial supraspinatus tear, for example, the supraspinatus is the most commonly injured rotator cuff muscle. If you have tension in the shoulder girdle from any of those joints I just talked about being misaligned or fixated, that can add to the stress on the tendon, increase pain and dysfunction, and potentially hinder its ability to heal. Extremely common with shoulder pain is pain that travels down the shoulder. Well, the nerves that travel to the shoulder and control the muscles and joints of the shoulder girdle, those come from your mid to lower neck, levels C5, C6, C7, and even some from the upper thoracic vertebrae like T1 and T2. So basically the bottom of your neck. So sometimes we see a disc injury like a bulge or herniation is putting pressure on the nerve causing that pain down the shoulder. So we have to address the neck first in those situations. But with any problem in the shoulder, the nerves that control that area come from the neck. So we have to make sure that area of the spine is functioning properly and that there's good nerve flow. So adjusting the spine and balancing the shoulder can help tremendously. We also address the muscles around the shoulder. Many times with shoulder issues, we find some really good trigger points that will balance as well. And I'll typically do this after the adjustment. Most patients feel immediate change in terms of pain and range of motion. If you have really tight muscles, let's say one that does this job brings the elbow down, does it make sense that you're not going to be able to go the opposite direction quite as well, like with raising your arm? Because it's really tight down here, that's going to restrict that opposite movement. So we check all of the surrounding muscles in the front and the back of the shoulder, and we balance those out too. Now we have some regenerative options as well that can be super powerful in addressing shoulder pain and dysfunction. They do really, really well to not only help reduce pain, but in actually helping repair most tendon tears like rotator cuff, super common, and labrum. One of my favorites for shoulder pain is shockwave therapy. This is a state-of-the-art modality that helps break up scar tissue and adhesions. If there's a ton of trigger points, it's going to help resolve those. The vast majority of patients with range of motion problems with the shoulder, they get some improvement after just one treatment of shockwave, as well as diminished pain with range of motion. Shockwave enhances collagen synthesis, it increases blood flow, releases growth factors. Basically, it stimulates your body's healing process to improve pain and increase function. Shoulder problems like tendinopathy, adhesive capsulitis, or frozen shoulder get phenomenal results with our shockwave therapy, combined with adjustments and rehab. What we really love for tendon, cartilage, or ligament injuries in the shoulder, and we'll often combine with shockwave therapy or cold laser therapy, is regenerative medicine options like PRP and ozone and human cell and tissue product. These are injections that either come from you, such as with PRP, where we take your blood and we process it to separate the platelets, which contain growth factors that stimulate healing and regeneration, or from an umbilical cord, which contain, among many other wonderful things, mesenchymal cells, which are cells that can differentiate or develop into any type of cell. So whatever your body needs, for example, if you have a tendon tear, those cells, when injected into the area, will become tendon cells. If you have a cartilage problem, when injected, those cells will become cartilage cells. If you're thinking, hey, I have a knee problem, can these cells be injected into my knee to help it heal? Yes, absolutely. When injected, these products help actually regenerate and repair the damaged tissue. Now compared to, let's say, a steroid injection, super common, which doesn't do any repair, it just decreases inflammation and it doesn't address any underlying issues. We see much, much, much better results with the regen, and it's all natural. One great example that comes to mind is a patient we had who couldn't raise her arm past 90 degrees. She had an injury and then her big dog ran into her and worsened it. And she was in a ton of pain. She wasn't able to do any of her daily activities. She got an MRI and it revealed, are you ready for this? She had a moderate 50% partial thickness tear of her supraspinatus, low-grade partial thickness tear of the infraspinatus, low-grade partial tear of the subscapularis. She had biceps tendinosis. She had moderate to severe degeneration of the AC joint. The only part of her rotator cuff that wasn't injured was the teres minor. Everything else was damaged. No wonder she was in so much pain. Now let me ask you, is a steroid injection going to help that heal? The answer is no. It might help with pain, but it's not going to help all that damaged tissue heal. So we ended up doing 3 PRP injections for her shoulder and cold laser therapy, about 12 sessions, to help repair all that damaged tissue. She was getting adjusted regularly and she had some exercises that she was doing as well. After that first PRP injection, this patient said that her shoulder felt fabulous and she actually had full range of motion of her shoulder back within a week. So it's been quite a few months now and since this treatment, and she has still full function of her shoulder with no pain, and she avoided surgery, which is what she wanted. Some other things I didn't mention, like breathing patterns, posture can play a role in shoulder pain, so we always address that if needed as well, assess and address it. What makes us different is that we look at your body as a whole and we treat it as so. We're an integrated clinic, so we have a lot of tools to help you heal and repair and get your function back. So if you have shoulder pain, let us help you figure out what exactly is going on with your shoulder and what options you have to get you healing and functioning better. We are here to help. You can give us a call at 708-403-5075 to set up an initial consultation and exam. It's very thorough. If you mention this video on shoulder pain with me, Dr. Mimi, we'll offer the first appointment, including the consult, exam, x-rays, and report of findings for just $49. And we will discuss what's going on with your shoulder. We'll discuss your options and our best recommendations to help you. If you have any questions, please let us know, and thanks for watching.